Given that there are enrollment issues, that people are having trouble enrolling in Obamacare, buying insurance, whatever, what about all of these folks who are losing their insurance currently because they're getting letters of cancellation notices from insurers? Are all of those people going to be able to obtain insurance in time to avoid the fines and the penalties and so forth?
Yes, and that's why we're so hard at work on making the website function. That's why we've expanded the means by which you can get the information you need and bypass the creation of an account and enroll. As you know, the people that you're talking about are, and it's important every time you report this for your viewers that they understand the universe. 80% of us across the country, 80% of the population receives insurance coverage through their employer or through Medicare, Medicaid, or the VA. 15% of us, of the remaining 20%, are uninsured. And for the first time, those 15% who fall through the cracks in the current insurance system that we have in this country have access to quality, affordable health insurance. 5%, the remaining 5%, currently purchase insurance on the individual market. A portion of that 5%, so not even the 5%, because they are not grandfathered in, because the policy that they currently have is not the policy they had when the Affordable Care Act was signed into law, are being told by insurers that they have to get new insurance policies that meet the minimum standards of the Affordable Care Act. And for them, there will be an abundance of options through the marketplaces, a greater abundance in almost all cases than it exists today. And there will be the opportunity for many of them, more than half of them, to get tax credits to reduce the cost of insurance. Without question, by definition, they will be getting better insurance than they currently have, because the insurance they currently have doesn't meet basic standards that the President believes and those who support the Affordable Care Act and passed it into law believe are necessary.
But clearly an unanticipated number of Americans, perhaps millions of Americans, may be experiencing these glitches, these technical problems, what have you, in enrolling for at least the next several weeks, who knows how long, right? I mean, that is
we've said
something that's going to be occurring.
We believe that the website, Healthcare.gov, will function effectively for the vast majority of Americans by the end of this month. And there are teams hard at work on making that happen, and they are making incremental progress towards that end every day. And while the site is not by any means without challenges or glitches today, it is better today than it was in early October, and it gets better virtually every day as these fixes are made. There's no question that this is important work. There's no question that the fact that the website had performed so poorly initially that Americans who tried to use it were often frustrated by it, and we are behind in getting the kind of information that we need to get to the American people and getting them signed up and enrolled, which makes it all the more important for us to make the website function effectively, make sure that these other means are available to Americans to get the information they need and so they can sign up and enroll. And it's one of the reasons why it was important to have, or it is good to have, a 6-month enrollment period. Because as we noted last week when the President visited Massachusetts,